mode.
Good afternoon and welcome to Washington State Public Health Association's April webinar, Gun Violence Prevention, a Public Health Approach. We are pleased to be presenting this webinar as part of our annual membership drive. Before we get started, we're just going to go over a couple of technical issues. First, you should see the control panel on your screen. And you are joined to the webinar as attendees in mute-only fashion. If you have any problems with the audio, you can switch between the microphone and speakers on your computer and the telephone. Just click in the audio box and follow the directions. Secondly, we will be taking questions at the end of the presentation. If you have a question, you can enter it into the questions box in the control panel, and I will be reading the questions to the presenters. And then lastly, the slides and the recording will be available later this week. So if you are interested, you should look for them on our website. And now we will get going with the presentation.
Well, terrific, and thank you, Betsy. My name is Tina Podladowski, and I'll be moderating this presentation. I'm currently the co-chair for the Washington Alliance for Gun Responsibility, and we're a citizen coalition that believes that common sense policies can reduce gun violence and that now is the time to act. Really, for the Washington Alliance, we believe that with the basic right of having guns in our lives also comes basic responsibility. And while there's been much debate in terms of responsible laws and things like responsible use and storage and ownership, public health issues, mental health issues, and public safety aspects of the debate have kind of taken a bit of a back seat. That's even the case today where, ironically, as we're on this webinar right now, I think the U.S. Senate is about to undertake a vote on several pieces of legislation, including background checks and a few other things there. So it's a very interesting time for all of us. I'm a former member of the Seattle-King County Board of Health and also a Seattle City Council member, as well as a former executive director of the Lifelong AIDS Alliance and Big Brothers Big Sisters of Puget Sound, where we worked with a lot of youth dealing with gun violence issues. We're joined today by two incredible speakers who have great presentations. The first is Karen Millman, and Dr. Millman is the Prevention Division Director for Public Health for Seattle-King County. She oversees numerous programs, including the Chronic Disease and Injury Prevention Program, the Medical Examiner's Office, and Vital Statistics. Prior to assuming that role, Dr. Millman was the Director of Public Health and the Health Officer for Nevada County, California. She received her medical degree from the University of Maryland and her Master's of Public Health from Johns Hopkins Bloomberg School of Public Health. She's board certified in preventative medicine. Councilmember John Snyder is a first-term council member representing District 2 in the city of Spokane. He's lived in Spokane most of his life and is a very proud graduate of Spokane Public Schools and the Evergreen State College. As a council member, he serves on the Spokane Regional Board of Health, the Washington State Traffic Safety Commission, and the Public Safety Committee for Spokane, sorry about that, City Council. As an ex-Seattle City Council member, that's just a slip of the tongue. Throughout his time serving on the council, he's been an advocate for strong solutions to the public safety issues facing the city of Spokane. So with that, why don't we start off the first part of this presentation with Dr. Karen Millman from the Seattle-King County Office of Public Health. Dr. Millman.
Great, thank you. Thank you for having me here today. As you mentioned, I'm going to talk about gun violence in Washington State and go over some of the data and why this is a preventable public health problem. Next slide, please. Thanks. So this is an overview of what we're going to talk about today. We'll give you a little overview of gun violence and talk about the Washington State data and give you some information about firearm ownership, and then talk about the public health approach to gun violence. You'll see as I go through some of the data that it's a bit more limited than we would like. It gives us some of the information, but we don't always know who is being harmed by guns, who owns guns, and all of that. And so that's a bit of a challenge as we try to approach our prevention activities for it. Next slide. In Washington State, more people are killed by gun violence each year than by motor vehicle collisions. In 2011, 619 people were killed by guns compared to only 497 by traffic crashes. We have a state traffic commission that's working on decreasing deaths due to traffic collisions, and so you can see that we need to have something comparable for gun violence. Next slide. Washington State is not unique. This is a problem that has been experienced across the United States, but we know it doesn't have to be this way because we can look at homicide rates in other developed countries and see that they're 20 times lower than our rates in the United States. And in fact, when you look at countries such as Australia or the UK, the rates are 30 times lower. We should look to these countries for the best practices and consider how we can approach things similarly here. Next slide. To provide another viewpoint for you, we just thought we'd let you know about the magnitude of this problem from an economic standpoint. We calculate that the estimated cost of gun violence in Washington State in 2010 was approximately $781 million, and that's a combination of medical costs and lost productivity. So the question is, what is leading to these costs? Next slide. We tend to classify firearm deaths in one of three categories: homicide, suicide, and unintentional deaths. And as you can see by this graph here, more than 3/4 of the firearm deaths in Washington State are suicides, and a very small number of them, just about 1.2%, are accidental. Next slide. When we look at homicide rates in Washington State, for every 100,000 people, there are 1.8 homicides per year. The good news is that this is lower, significantly lower than the U.S. as a whole, which has 4 per 100,000 people. Next slide. But gun violence doesn't impact everyone equally. When we look at the information, we can see that young males are more likely to die from firearms than others. In addition, African Americans face firearm homicides rates 4 times higher than whites. And gun violence doesn't affect each county in Washington State equally either. Firearm homicide rates in Yakima and Grant counties are twice as high as Pierce County and 3 times as high as King County. And on the next slide, we have a graph here to show you how it's distributed for the homicide rates, and you can see there's quite a difference in where they're occurring. Next slide. For suicides, the rates are slightly different. In Washington State, there are 6.5 suicide deaths for every 100,000 people each year. As we saw earlier, this is approximately 3/4 of the deaths due to firearms. And in comparison, this is actually higher than the U.S. rate. Next slide. When we look at the demographics, elderly men have the highest rates of suicide by firearm, and men are 7 times more likely than women to commit suicide with a firearm. In addition, whites and American Indians and Alaskan Natives have the highest rate of suicides. Next slide. And so when we look at this, you can also see that there's a geographic difference on the map here. So you can see that the areas that may have higher suicide rates are actually different than the counties that have higher homicide rates. This sort of helps us tease out what is the picture and what are the problems and how our approaches might need to be different. Next slide. Moving to unintentional injuries, as I mentioned earlier, they're only a small portion of the deaths of firearms in Washington State. In Washington State, there were 9 unintentional firearms deaths in 2011, and there were 35 total between 2006 and 2010. In 2011, there were 99 hospitalizations that were reported from unintentional firearm injuries. As with homicides and suicides, men are much more likely to be injured by firearms than women. But the number of unintentional injuries and deaths from firearms should be 0. We looked and have heard about increasing problems with this. Last year, you may remember, in 2012, there were 3 cases, 1 in Kitsap, 1 in Pierce County, and 1 in Snohomish County, where children got their hands on a family firearm and unintentionally shot either a classmate or a sibling. Access to firearms is a contributor to the problem of unintentional firearms. And we also know that in the school year of 2010 to 2011, there were at least 103 incidents involving children bringing weapons, firearms, to school in Washington State. So these firearms are coming from somewhere. Next slide. Using some of our survey data, we estimate that 36% of Washington state homes have at least one firearm. Firearms kept in the home are associated with an increased risk of homicide, especially by a family member or an intimate acquaintance. With the right to own a firearm comes the responsibility to store it properly, locked and unloaded with the ammunition stored separately. But unfortunately, this isn't always the case. From the statewide data, we know that there are approximately 55,000 children who reside in homes where there are firearms that are stored both loaded and unlocked. We need to do a better job about this. Next slide. So when we look at this, we've been, as many of you have heard, speaking in different events across the state, we've been saying we need to use a public health approach to help solve this problem. The question is, what does this mean? Public health is defined as what we, as a society, do collectively to ensure the conditions in which people can be healthy. So this means we're taking a broad approach. We're not just saying that the government needs to regulate people's behaviors, but we're saying it's our collective action that's needed to change the environment, to change our systems, and to look at the ways we're operating to change the social norms to address this problem. A public health approach is data-driven and science-based, so we need the information, including substantial more data than I just showed you, to try to figure out where to intervene. And then when we come up with interventions, we do the evaluation for it. A public health approach is also prevention-focused. We want to look upstream at the factors and the variables that are contributing to the problem to try to prevent it before it begins. A third characteristic of a public health approach is that it is population-focused. We're not just looking at individuals, we're looking across the community. And finally, a public health approach is multifaceted, acting across different levels and different targets. And that sounds like a lot of jargon. But what we mean by that is across different levels is it's not just looking at education and looking at one person, but we're also looking at how do we change policies. So we're changing how the environment is structured, and how do we change systems, whether it's the education system or the hospital system or the government system, to try to address the problem. In addition, we use different targets. So for those of you who may recognize this from injury prevention, what I've got at the bottom of this slide here is what's called a Haddon matrix, which is really basically just a framework to walk us through looking at all the different approaches that one could take and make sure that we're addressing multiple different levels. So the best example of this is looking at what we've done for traffic accidents. So you go across and we want to look at what happens before an event occurs, what happens during the event, so either a crash and car accidents or a shooting when we're looking at gun violence, and then what happens after it to prevent the problem from worsening or occurring. So for traffic problems, we looked at pre-event, and we might have said pre-event and looking at the person involved, and we might have said, well, were they intoxicated, or were there driver's trainings, or there's a place there that's here that we can intervene. Or we might have looked at the physical environment pre-event and said, is there a problem with the road, and is there a way we can change this? For traffic evaluation as well, when we had the event and actually the occurrence of the crash, we'd say, well, what can we do in terms of making the car safer? So that's looking at the event and the agent, so airbags and crashworthiness. And then after the event, post-event, we'd look at the EMS response, so the social environment and the physical response. And it was only by attacking all of these different aspects of traffic injuries that we were able to make an impact. We can apply the same approach to gun violence. So for the pre-events, we can look at the host and we can say, do we need background checks to influence who is the host and who has access to a gun? And we can look at the physical environment and say, do we have safe storage practices in effect? And during the event, we can look at the physical environment and say, can we place limits on the amount of ammunition that is available? And is this a way to modulate what is actually happening during an event? Or we can look at some actual ways that the gun is manufactured. So are there specific safety locks on it? Does it need a fingerprint of the owner in order to fire? And then finally, we can look post-events for gun violence, and we can do things like for social outreach. If we have a victim of a homicide, when we go in and we talk with the victim and we make sure that they're not going to retaliate. Or for suicides, if you do outreach to the community that's affected to try to prevent a cluster of suicide. Next slide. So we can look at this, and there's reason to be optimistic. By using this public health approach in the past, we've managed to make great accomplishments. I've talked about traffic safety, but we could also talk about tobacco, where success was built on changing multiple things. So we looked at regulation of taxes and an age of purchase, and whether or not we had fruity flavors that attracted youth. And we also changed the environment with smoking bans, and we did education. And then, of course, with all of our interventions, we did evaluation to adjust things. And if we use the same approach to looking at all the factors that are contributing to gun violence, and we learn from our successes in the past, then we have a methodology to apply to attack the problem here. Next slide. So I think that we're going to turn it back to you, Tina.
Okay, super. I actually have one question in terms of data strategies, and you and I talked very briefly about this. Just in terms of thinking about the different public health departments, the county public health departments, as well as the Department of Health in the state of Washington, and just thinking about all the data-driven strategies, what do we need to do in terms of looking at data that's out there, or potentially the lack of data that's been collected because different health departments have had their hands tied or have not had funding to appropriately collect that kind of data. Anything you want to say about that? Because I do think that that's pretty key to putting together a lot of these strategies.
Yeah, so that is one of the big challenges. The challenge isn't just that research has been blocked because of funding, it's also a challenge of how to gather all the research together, all the data together. So we're looking in health department, we're looking at data from death certificates and from the medical examiner's office, but the challenge is how do you get the rest of the data? So how do we get the information that law enforcement has, or that the courts has, or that the social workers may have, and how do we put it all together so you can analyze across it? And that's a big challenge with figuring out privacy issues, because you really want to be able to link the information so that you know that you're talking about the same case and you can compare what variables may or may not have had it. And the data is really not largely available. The health departments may have some of it, the law enforcement may have it, but they may have it in individual records in a written form and not in some sort of database, and the database may or may not, if they have one, talk to someone else. And so it's really a matter of figuring out how to connect it all and gather it all.
Okay, that's terrific, thanks. I think this leads a lot into the work essentially that the Alliance has been doing to try to figure out all the different components that need to come together really in a multi-year strategy around guns, gun violence, data collection, and then how that feeds into a public health campaign. Again, the work that we're doing is not just about laws. It really is about trying to figure out how we put together these multifaceted campaigns. And I think of strategies back to sort of my days working with the Lifelong AIDS Alliance and HIV/AIDS issues, and sort of one of the things that has come up very clearly is in this work is to not stigmatize gun owners around this piece of it, because reasonable folks who are gun owners, who may use guns, suddenly drop out of the debate if we go into the stigma and shame aspect of doing this. So it was interesting to hear you talk about the various aspects of putting together sort of proper campaigns and the pre-event, the event, and the post-event aspects of that. Because as we start to go through messaging that's a bit more marketing in its orientation and just common denominator, some of the things that are coming up here is this idea of making sure that we're not inherently saying that gun owners are bad people, but that we are being very clear that gun ownership in this state impacts all of us, whether we own a gun or not, whether we live next to somebody who owns a gun or not. And I think that's a bit of the work that Councilmember Snyder has been doing. We just got word that his plane from Spokane that was due to arrive in Seattle is running a bit late. So I'll take you through his slides very quickly, and then we'll open it up to questions for folks. So let's go to the first slide for Councilmember Snyder. In the city of Spokane, he was elected in 2009, and as I said previously, he served on the Regional Health Board, the Traffic State Advisory Commission, and he's also chair for Aging and Long-Term Care efforts in Eastern Washington. Let's go to the next slide. Many folks on the call might be familiar with stats for their city. I'm certainly familiar with the statistics for the city of Seattle, but let's just talk a minute about Spokane and what we're looking at here in this particular environment. 210,000 people, almost 60 square miles. It's a strong mayor system and a unicameral legislature versus city council. So 3 districts, each represented by 2 council members and 1 council president who's elected at large. Can we go to the next slide, please?
Hello.
Oh, great. Hello.
Hi, this is John. Have you come to my part yet?
Oh, yes, John. This is Tina Pawlodowski, and we've just started. I am on your second slide here in talking about problem in Spokane. So if you're all set to go, let's take it away.
All right, let's do that. So you got the details on Spokane.
Yeah.
Can you hear my voice okay?
Yes.
Okay, great. I've got the slides in front of me here. You see about the size of the city of Spokane and some of the issues that we're looking at as far as what the problem is. So let's try to look at, some of the issues we're having in Spokane with guns. First, we've had some really high-profile incidents. We had a shooter in a commercial area that shot up a restaurant and a whole area around it. Even shot at his father who lived in the area and was ultimately shot and killed by police. And at Loop Fest in 2011, we had a shooting in the midst of, basically we have 80,000 people or more downtown for this weekend, and we had a gun crime that fortunately didn't result in any fatalities, but was a very high-profile incident. And then just recently, just in February, there was another high-profile incident where a person went on a multiple shooting rampage near a grocery store on the South Hill. So those are some of the things that loom large in people's minds in the city of Spokane. I don't know if anybody has seen the recent New York Times article about how gun rights trump orders of protection, but they used an example from Spokane as the lead story in that piece, and really talked about how Washington State, it's really difficult to trump gun rights when you have a domestic violence situation with orders of protection. I've included the link there if anybody wants to read it. It's a really interesting piece. And then this December, we had a rational homicide, 6, which was a lot. I mean, we've had years where we haven't had many more homicides than that, and 4 of them involved guns in December. So that's a look at kind of what some of the problems that we're facing are. So next slide, what are the barriers to policy solutions? Well, as you might imagine, there are multiple barriers here, and one of the big barriers to me as a policymaker is the lack of data. When we had this problem in December, I asked our police department for some numbers, and they told me they only tracked really, gun homicides. Non-fatal shootings or shootings that don't result in injury aren't tracked in the same way. And on a state level, what I found is there's usually a 14-month lag sometimes from when our state data is compiled and when you can get a hold of it. And just a couple months ago, I signed on along with Councilmember Tim Burgess and several other local officials around the state, sending a letter to Mary Selecki requesting that Washington State submit data to the National Violent Death Reporting System. And Secretary Selecki sent us back a letter informing us that that system is federally funded, and the only reason there's only 18 states that participated in it is because that's all there is funding for at this moment. So the data is kind of a two-way street. I wish we were generating data that was part of some of this national aggregation of data and informed national policy. And I also, as a local city councilman, don't feel like I have enough local data to react to things sometimes. So next barrier, next slide. State law trumps local laws. So I've included some of the language here, but folks may be familiar with this. There's really very little a city can do as far as anything regarding guns because state law trumps. at City Hall, this has actually been a concern recently because we've had some folks in Spokane who have concealed weapons licenses who are, I don't know how you describe it, just big aficionados of city politics and come to City Hall very often. And because we don't have, my understanding is that we legally cannot restrict folks that have open carry or concealed carry licenses from, coming right into council chambers. It's a similar situation that they have at the state legislature. And that becomes a concern, not just for the people who work in City Hall, but for the citizens that are in City Hall. And the fact that we have no discretion over that is kind of troubling. And the big topic of discussion right now, of course, is universal background checks. And I included a line there from last week's New Yorker, and I'll just read it really quick. For requiring background checks for gun buyers not currently subject to them, a reform that polls show is supported by 90% of Americans and by 85% of gun owners, and which the NRA itself supported as recently as 1999, is now, the Washington Post reported, in jeopardy amid fierce lobbying. Well, I think that's true, and that's a similar dynamic plays out in our own state as House Bill 1511, died this session as well, even though there's a lot of popular support. And then the last barrier really is local political opposition. I brought forward a resolution regarding reduction in firearm violence, and it encountered enough opposition from my fellow council members that I broke it. I removed some of the broad provisions, broke it down into two really specific resolutions that addressed actual legislation that was, alive at the time in the House. One was 1096, unlawful possession of firearms by a juvenile. It was asking for stiffer penalties in those situations. And here again, we're not talking about lawful possession. We're purely talking about unlawful possession of firearms. And then 1114, a bill folks may be familiar with, made it easier to commit violent offenders, including those that use guns, when they're not considered not competent to stand trial. So both of these resolutions were blocked, not just voted down, but our majority on our council, we have a 7-member council, so the 4-person majority blocked them from even coming up for a vote. And I think a lot of that is the local political reality mixed with NRA pressure, talk radio, and what have you. But it was dismaying to me that we couldn't even come to a discussion on those and actually get to a vote. So what other avenues do we have? Well, of course, the public health approach, and this is something I'm very interested in because my work on the Washington Traffic Safety Commission and my work with bicycle, pedestrian, and transportation advocacy, I've seen how data-driven approaches in a public health to issues like this in the public health sphere can be really effective and really help if we have the right tools, if we have the right data, and we look at it as not so much a hot-button political concern, but as a pure concern of public health. So with motor vehicle safety, you have a whole list of things that have been really effective and really beneficial in making our roads safer to drive on and walk on, what have you. They're all strategies that have various applications as far as firearms are concerned. In the next slide, gun violence prevention, safety standards, inspections, passive protection, all these sort of things are different ways that firearm violence could be addressed with public health tools. And this is really important to me because of my being on the board of Spokane Regional Health District, and it's a great organization which I've seen us approach a lot of different public health problems in very effective ways, and I see no reason why firearm violence shouldn't be one of those. So, all that would kind of lead you to believe that the future is, kind of difficult or grim for trying to approach these problems. But let me get to my last slide. There's hope. I think there's a lot of hope for the public health approach, stemming from just one thing that happened to us right here in Spokane County. At our last regional health district meeting, we passed a resolution. I thought the wording was actually stronger and better than what I had originally proposed at Spokane City Council regarding firearm safety, and it passed. And this is a body that is made up of not just City of Spokane members. We have small towns, Cheney. We have smaller towns like City of Spokane Valley, which is actually 100,000 folks, Airway Heights, and at-large members from the public. We were able to, it's a pretty diverse board for a health board, I would say, different as far as urban and rural sorts of representation. And we were able to pass that. I thought that was really encouraging. I thought that really shows that maybe the public health approach, has some real opportunities. If we can do it in Spokane, maybe we can start looking at it in other places. So that's kind of in a nutshell my perspective as a city councilman on these issues. I feel like we don't have enough tools right now, but there's a lot of barriers to going forward, particularly having to do with data and state law. But I think the public health approach offers a really maybe an opportunity to leap some of those barriers. And that's pretty much it.
Great. Thanks so much, John. And we're really glad you could join the call today.
Oh, God, it was a nail biter there, man.
That's terrific. Thank you so much for being here.
All right. Go ahead.
Yeah, I'm going to talk a little bit more about the Washington Alliance for Gun Responsibility, what our next steps are, and then while I'm doing that, if folks would like to ask questions of any of the presenters, do know that you can type your questions into the questions box on the GoToWebinar control panel. So be thinking of those questions if you've got them, start typing, and we'll have some time to be able to answer those pieces here. A couple of the things that Councilmember Snyder mentioned as well, through this legislative session, we've worked, the Alliance, with our lobbying team and with a couple of different key legislators throughout the state to take a look at different pieces related to both the public health side as well as gun responsibility laws. In looking at the polling data throughout the state of Washington, I think there's still a lot of work that needs to be done in terms of sort of explaining to folks and getting what data we have out there on the public health side out in messaging that folks can understand. As part of the Alliance, that's what we're looking to do in terms of a public education program, and again, work with every county health department as well as the Washington State Department of Health and John Weisman, the new Secretary of Health for the state of Washington, around those issues. But within the polling, one thing that's really clear, and that it doesn't matter what part of the state you're in, if it's suburban or rural or urban, if you're an NRA member or not, your age, this is something that cuts across all these folks, which is 8 out of 10 Washingtonians supporting universal background checks. Sadly, it's a bill that didn't make its way through the legislature this year. That was Bill 1588. It did not come up for a vote. There was a whole host of other bills related to funding for public health and mental health issues, some other bills related to gun safety that really didn't make it out of the session. And then there's 2 bills that are actually, today's the critical deadline for. The first is House Bill 1612, which would create a felon firearms database. And it passed the House 85 to 10, but it's getting stuck in the Senate. And then House Bill 1840, which is something on a topic that Councilmember Snyder alluded to in his presentation, which is requiring a person found to be a credible threat to their spouse or partner to surrender their weapons. So that's the protection order issue. And those things are both of those bills are kind of hanging on by a thread this time, but we'll see what happens. With the Alliance itself, our goal is to move forward in 3 different kinds of campaigns. One is really is a campaign, and by the end of this month, April, you should be hearing an announcement from us on legislative action that we'll be pursuing going forward, up to and including an initiative campaign. Also, we're looking at different ways to look at the state budget and, again, work with the departments of health and also outside funders on data collection and a whole host of other issues in terms of being able to really peruse that data and come up with a variety of different strategies around that piece of it. So a lot of this information is available at our website, and I urge you to check that out. It's www.wagunresponsibility, all one word, .org. And with that, I want to turn this over now to Betsy to see if we've got any questions for folks who have been a part of this.
Thank you, Tina. We do have a question that just came in about the content of the resolution that was passed in Spokane. Councilman Snyder, can you address that?
Yeah, I don't have the content of the resolution right in front of me. Maybe Lydia has that. But yeah, shoot away.
Could you give a general idea of what was in it, since you had mentioned that the language was stronger than what you originally proposed?
So what I thought was a little bit stronger was they were asking for the legislature to take concrete steps to reduce firearms violence, and I couldn't get somewhat of a conservative majority on our Spokane City Council to even agree to that sort of language. They felt that that was too broad. They weren't comfortable with it, and so I was really pleased to see that very specifically addressed in the Spokane Regional Health District resolution.
Thank you. Okay, another question has just come in. After the Port Arthur massacre in Tasmania and the Dunblane shooting in Scotland, Australia and Great Britain successfully introduced massive restrictions on personal firearm ownership. Now that it looks like little meaningful change will take place in the U.S., do you think that more mass shootings might finally sway American voters?
Well, this is Tina. That's an interesting question. I feel certain that the heinous things that we've seen in our cities in Washington State, and then certainly what's happened in Colorado, what happened at Sandy Hook Elementary, I suspect, sadly, we'll probably see repeats of those. So these types of incidents won't go away. I do think what's happened, though, is that there's been a long effort by the National Rifle Association, the gun manufacturers, to get legislators to think about these gun issues in one way. And there hasn't necessarily been sort of an organized effort that has an opposite viewpoint of these guns issues around the public health aspects of it, the responsibility aspects of it, safe usage and safe storage kinds of issues. So I think that would be all of us kind of coming together around these issues. At the federal level, there's 3 key organizations working on this. The first one is Mayor Bloomberg's group, which is Mayors Against Guns. The other group is the Brady Campaign, and then the third group itself is the Gabby Giffords, Mark Kelly group, Americans for Responsible Solutions. In Washington State, the Washington Alliance for Gun Responsibility is keyed into all of those. So I do think what you're seeing, and if you're looking at your Facebook feed probably today, is just a resurgence of interest in people who are not going away on these issues. So expect it to be one, I think, that will not get solved overnight, but I can't imagine over the next decade that we won't make significant progress on these issues. Anyone else, please do jump in.
Okay, we have another question that came in around the funding issues that a lot of the local health jurisdictions are facing already. Can anyone speak to how they're working to prioritize the research on gun violence in their jurisdictions, given that there are a lot of other issues that they're also dealing with?
Well, this is Karen. I think that is pinning one of the problems down pretty clearly, that with the restrictions or the reduction of resources that health departments are facing, it is hard to add something that seems somewhat new, because we haven't been doing a lot of active work on gun violence prevention because there hadn't been a funding source for it. I know that in King County it's been made clear by our officials that this is a priority, and so we're looking at how to readjust some of what we're doing and dedicate some people's time to continue to work on the issue.
I would just pipe up and say that's a huge issue in Spokane. We are shedding services and trying to, we've had to shut down one of our labs. We've had to transition some services outside the health district, and so that's definitely a big issue for us here in Spokane.
Okay, and another question is, with the work being done in Washington State, could you also speak to maybe what models are being explored in other states that Washington might want to look into or might become more of a reality in Washington in terms of gun violence prevention?
I'm sorry, could you repeat that question?
Is there any other work being done in other states that Washington is kind of looking at to model its initiatives after?
Well, from the standpoint of a statewide organization, folks might be surprised to hear that, at least in the opinion of the national organizations, we're probably far ahead of most of those states that are looking to have citizen-driven organizations be a part of this. So I think Washington State is trying to lead in that area and work with other states to look at model legislation and model initiative campaigns as well. Obviously, Connecticut has passed some significant laws. Colorado has passed some significant laws. But the power of the initiative process, maybe not 2013, but certainly 2014, in a variety of different states, is some place where not only could we make significant legislative change, but we could also significantly impact the resources of organizations like the NRA. For example, the cost of putting an initiative campaign on the ballot, gathering the signatures needed in Washington State, which right now is about 330,000 signatures, probably is about $1.2 million, something along those lines, $1.5 million. But fighting something like that at a statewide level would cost an organization like the NRA possibly, $10 to $15 million. You think about 10 states running initiatives, 20 states running initiatives, that could be a significant impact, as well as continue to keep these efforts in the public eye.
Great, thank you. Okay, our next question. On the federal level, one of the conservative senators who supports background checks stated that background checks are supported by a majority of gun owners only if there is no keeping of records. On our state law proposal, does the 8 of 10 supporting background checks, is there information as to the keeping of records and support or not for that?
It's an interesting question. Jamie Peterson's Bill 1588, I do believe that the records were destroyed, but don't quote me on that. I just want to go back into the final reading of the bill because there was 2 amendments around those pieces of it. But I think it does raise sort of a bigger issue in terms of thinking about guns, as a whole, and this idea of records in terms of who has guns, licensing in terms of who has guns. Do you need to have a gun permit or license in the same way you need to have a driver's license? So is there gun education that needs to happen around these kinds of things? Is there a limit to the number of guns folks should have? I mean, all of these things I think will come up for debate over the next decade with some pretty interesting results. The other aspect of it too is just inherent gun safety of the weapons themselves. Right now, for weapons, one of the issues with children, particularly if they get access to a gun that's unsecured, is even if, for example, with many handguns, if the clip is out of the gun, there still might be a bullet in the chamber, and here they are playing around with this gun, and they accidentally shoot themselves or a playmate or a family member because there's no way to tell that there's a bullet in that chamber. Things like trigger pulls on weapons as well keep 2-year-olds, 3-year-olds, 4-year-olds from being able to shoot those kinds of weapons. So I think there's a whole host of issues that people will talk about, debate, make sure do not infringe on the purview of the Second Amendment, but at the same time are reasonable in their ability to sort of regulate what makes sense in our society today.
Can I speak to that for a quick second? The dynamic is so bizarre and upside down politically on this. I'm just going to speak really politically. In the New York Times recently, they talked about how 5 states in wake of the Newtown shootings have enacted more stringent gun laws, but 10 have actually loosened their laws. So we now got to this point where we have a big incident, and it's causing pressure to go in the other direction, and it's fueling gun sales. As a matter of fact, my dad lives in Louisiana, and there's politicians down there trying to advocate for lifelong gun registration. So like maybe run, and that's something I'd never heard of before, and I don't know if that's going to spread around the country, but it's an interesting thing.
I think it also speaks to this issue of inherent safety and how people are feeling around this whole issue of being safe in their own lives and being safe in their own homes. And it's sort of interesting to think about that in the context of gun ownership as well. But we're a culture that has, over 300 million guns, I think, in the United States. The figures vary since we don't keep those kinds of records. I don't think guns will go away in America. And I think, but the responsibility that we have in terms of use and storage and ownership and gun safety, I think they're certainly part of what we need to think about, and then also the impact to the public and public health issues around this, whether we're talking of issues related to suicide, whether we're talking about issues related to other aspects of mental health, whether we're talking to the cost to the public in terms of gun incidents, which are numbers people very rarely see, that certainly add to the cost of health care in America and in Washington State. I think those are all issues people will be having discussions about in the years to come.
Okay. Our next question. As Dr. Millman noted, we've had some terrible tragedies involving children easily accessing firearms. Typically, those adult gun owners are not prosecuted or held responsible. Does the Alliance see a safe storage of firearms law that should be pursued?
I think all those things certainly should be under consideration and part of the debate around that. The last time I think Washington State looked at safe storage as an issue was back in 1997, and there was a citizen initiative related to that. The initiative had a variety of different components to it and failed miserably, even though I think everyone probably agrees that common sense safety issues are not ones that are unreasonable in this debate. So I think folks need to think about all of those components of it when thinking about next steps here.
Okay, does anyone else have any questions that they would like to pose to our presenters? Please enter them now. Okay, well, thank you so much for joining us today. We were very happy to be able to offer this webinar to you on this incredibly important issue. As I mentioned at the beginning, WSPHA was putting on this webinar as part of our annual membership drive. If you are interested in membership, please visit our website. WSPHA is involved in a number of activities. We offer webinars and the annual Joint Conference on Health. We are a major advocate for public health issues in Olympia, and we are creating a network of public health professionals in Washington State. If you have any questions about the presentation or membership, you can visit our website, and the slides and the recording will be available. Thank you.